Well, May marks Maternal Mental Health and Wellness Month. It is believed that 1 in 5 women experience mental health concerns during pregnancy or just after childbirth. Dr. Holly MacKenna with Dara Wellness joins us now to detail how we can spot the signs. Good morning.
Good morning.
I think first I want to ask you, why is it so important that people know about maternal mental health? Why is this a public health concern that everyone should be aware of?
You know, it's actually the #1 preventable reason for maternal mortality is having a mental health concern that isn't addressed. As you said in the opening, 1 in 5 folks who are pregnant or postpartum report some type of mental health issue, and only about 20% of those women are getting screened for it. Along those lines, then about half of the folks who report having mental health issues are getting the follow-up care that they need. So it really is a concern that affects all of us. It affects the mom, it affects the family unit.
Absolutely.
It's difficult to bond with your baby when you're not feeling great yourself. And we're seeing that then in outcomes for the infants as far as their growth and their bonding with their moms.
Sure.
So it really is something that we all should be concerned about.
What is the reason, I suppose? Is it the hormone imbalance? Is it what we hear about, sort of the lack of support for mothers in our country and around the world? What causes it to be such a large number, 1 in 5?
Right? It's really all of the above. So we know about the drop in hormones. That's what causes what we call like the baby blues.
Sure.
That happens those first couple of weeks. And you know, the lowering of hormones, we think, also affects the neurotransmitters that affect our moods and our anxiety levels. And so that lowering happens. You have, you know, the tearfulness, the low energy, the difficulty with sleep. Again, that happens for about 2 weeks, and that's considered normal, which it doesn't feel great. I remember.
No, it doesn't. I remember
Yeah.
for being such a social, outgoing person, I remember the baby blues for me were just not wanting anyone around.
Right.
And that's very atypical of me. I love having people in my home.
Right.
But I just remember being like, oh, can everyone just leave?
Yes, yes. And then on top of that, you do feel alone. You do have that stress. You're in the middle of the night feeding your infant.
Sure.
No one is around. It's very lonely. You kind of go from everyone looking at you having the baby shower and it's all about you to it's really not about you anymore.
Right.
And that's a big change. That's a big stress. And, you know, as women, we often take on all the things. So you just had an infant, your body needs that time to recover, but we're still trying to do the laundry and trying to
Dishes and all the nonsense.
things. And I mean, when you talk to a woman who's just had a baby and ask her when she's like washed her hair, like that's usually you just get like this phased out look. You know, the self-care just goes out the window, and all of those things are super important for keeping your mental health up.
So if you have a new mom in your life, or a pregnant woman in your life, which most of us, I think, know somebody right now, what signs are you looking for to know if they're having the baby blues, which is considered normal, or if there's a more serious thing that they really need you to step in and help with?
Right. We talk about that 2-week mark because that is when kind of the, again, normal lowering of hormones takes place and that change happens. But if you're having hopelessness, if you're not able to sleep, if you're having difficulty with your weight, like eating and kind of staying on track, your energy, you're feeling like you're bonding with people, including your baby, and of course if you have thoughts of death of yourself or your child, feeling like you're not safe for your child, those are all signs to reach out for help. And that's one of the #1 things we do in mental health when we have a mom that has concerns is get help for her. And that can be me, psychiatrist, but can also be spouse, partner,
hey,
mom,
you really
dad,
need to wash the baby bottles or the pump parts or whatever. Those little things, just having a little more support at home can sometimes offset a lot of those big feelings that moms have.
It really does make a huge difference. Like you wonder, you know, it's Mother's Day coming up. Think of like what young moms you have in your life. I've had women present to me in the first 2 years of their children's lives with postpartum depression and anxiety because they just didn't know that's what was going on, and it took that long to get diagnosed. So reaching out to them, offering to, hey, can I go shopping for you? Can I come over and hold the baby while you do wash your hair and have some self-care? Or maybe, I don't even go out and have lunch by yourself, or something that just gives them a little bit sense of self, because I mean, we adore our babies. You know, we're both moms.
But sometimes you just need a little moment to yourself.
You really do.
Dr. Holly MacKenna, thank you so much. Raising awareness is the first step, and hopefully some moms out there saw this and reach out for help.
Absolutely.
All right. You